Hey, I'm Igor from Aesthora, where we help people plan successful glow-ups and safe surgeries. Today, I'm answering 21 real questions people asked on Reddit. If you've got a question of your own, drop it in the comments. I might feature it in the next video. Let's get into it.
This isn't fat. The lighting creates the illusion of fullness around your jaw and neck, but there's minimal actual fat present. Your nose doesn't look bad. The issue is structural. You likely have a paranasal deficiency, which creates a sunken appearance. Paranasal implants could help restore balance. It's hard to say without a side profile, but your nasal tip does appear slightly upturned. The main concern is a long philtrum. Lip lift could help. It shortens the philtrum and increases visible upper lip height, which may bring better facial balance. I've had the procedure myself. Feel free to ask questions. The filler wasn't placed incorrectly, but it seems too much was used, unless you're very early post-injection, in which case swelling might still be playing a role. You likely had prominent cheekbones before. You should wait for it to naturally absorb. I would avoid dissolving unless absolutely necessary due to the unclear long-term risks. You're a great candidate. Lip filler would suit you well. If you're worried about a sausagey look, consider a lip lift. It doesn't add volume, but it enhances upper lip height and shape. Fixing crooked teeth is widely accepted because it's often linked to functional health. Rhinoplasty can address major issues like breathing and trauma too. Unfortunately, far fewer people are aware of the medical benefits, which contributes to the perception that it's purely aesthetic. However, acceptance of cosmetic surgery is rising fast. 2021 YouGov poll showed 43% of Americans under 30 would consider it. It's difficult to confirm from a photo whether someone has had surgery. There are no visible alarplasty scars here. The most common cause of triangular nostrils. It's likely natural, though we can't say with 100% certainty. Nostrils get distorted only if too much skin is removed. Anne Hathaway has never confirmed undergoing surgery. She tends to avoid the topic in interviews, which leads to speculation. At 42, her lack of visible wrinkles raises eyebrows, but there's no visible scarring. Heavy makeup and lighting differences can also dramatically alter appearance. A chin implant is often the best option. I had one done this year. It's minimally invasive, allows for sizing flexibility, and it's removable if you're unhappy with it. Genioplasty is more invasive and less reversible, so unless there's a health issue, implant is ideal. A lip flip won't completely stop the upper lip from thinning when you smile, but it increases the visible height of the lip, even at rest, creating a fuller appearance overall. Since your upper lip appears naturally thin, this could be a great enhancement. Repositioning the brows can shift surrounding tissue, which may unintentionally age the eye area by increasing upper eyelid exposure. Low brows and a strong brow ridge are actually attractive masculine traits. I'd recommend leaving them as they are. If you still want elevation, consider a subtle Botox or thread lift. Your veneers look great. The front two are slightly larger, which is actually common and natural looking. There's no boxy appearance, and the color match is excellent. As a tip, never get just 6 veneers. 8 provide better symmetry and blend. Tanning moisturizer is safe 1 week post-treatment, even sooner, as long as the skin is intact. Just avoid unprotected sun exposure. The reason for avoiding heavy weight training is to prevent increased venous pressure that could impact healing or disrupt vein closure. Clamshells are likely fine if done gently. Planks raise core pressure and are more borderline. Best to wait until after the first week. Yes, your chin is quite pronounced, with both vertical and horizontal projection that throws off facial harmony. A reduction of height and forward projection would help restore balance. You're an ideal candidate for this. Botox in the mass eater can reduce jaw width non-surgically. However, it may not provide the results you want long-term. If you decide on something more permanent later, jaw shaving would give you the ideal contour. Many clinics delay sharing exact pricing until after a consultation. That's common since every patient's anatomy and surgical plan varies. But if a clinic refuses to give even a basic range, that's a red flag. Consider finding a provider who's more upfront. Plastic surgery comes from the Greek word plastikos, meaning to mold or to shape. It has nothing to do with plastic materials. The term was first used in the 1830s when surgeons began reconstructing faces and limbs long before synthetic plastic was invented. Pushy sales tactics are a major red flag. Your clinic didn't behave professionally. Facelifts are meant to lift sagging tissue and restore definition. not drastically change your facial identity. Limited jaw movement is likely from post-op tension, not nerve damage, which is rare. Track your healing daily with consistent lighting and angles. If you still feel off months later, you might consider fat grafting or dermal fillers to restore balance. A post-trauma lump isn't always a lipoma. It could be scar tissue, a calcified hematoma, or even bone irregularity. You need a proper diagnosis. Medicaid typically covers diagnostic exams tied to trauma. Ask your primary care doctor for a referral to dermatology and maxillofacial surgery. Then get a CT scan. Treatment will not be covered if deemed cosmetic. The difference is clear. Your Botox results are excellent. Wrinkles are dramatically reduced. Your skin looks smooth and natural. Even before, your lines were mild. Now, they are even more refined. At 2.5 weeks post-ptosis surgery, some slight drop in the eyelid is still expected as swelling subsides, and the levator muscle relaxes. What looks like overcorrection now is often temporary. The real result settles between 6 to 12 weeks, so give it time. Buccal fat removal isn't inherently bad, but it's permanent and best suited for the right face shape. There's no guarantee you'll look gaunt in your 40s. The fat pad is completely removed, so it won't expand later. Because you have naturally fuller cheeks, you're more likely to get a good result. The procedure can add definition without making you look overly hollow. That's it for today's questions. Hope this helped clear some things up and gave you real insight. If you found this useful, give it a like, share it with someone who's planning a surgery, and subscribe for more real advice on getting the results you actually want. And hey, if you've got a question I didn't cover, drop it in the comments or DM me. I'm always happy to help. Until next time, stay smart, stay safe, and plan your glow up the right way.